Hi, I'm Michelle Ginsberg. I'm Director of Cardiothoracic Imaging and Vice Chair for Education at Memorial Sloan Kettering Cancer Center. And I'm also a professor of radiology at Weill Cornell Medical College. A lung cancer screening CT is a regular CT, but it uses lower radiation and it's optimized to look for the lung parenchyma, while the while the rest of the thorax, which includes mediastinal vessels and structures, is not as well seen because the resolution is somewhat lower due to the lower dose of contrast. Now, lung screening is recommended by the United States Preventative Services Task Force, and they recommend annual screening for lung cancer with these low dose CTs in adults that are 55 to 80 years and who have a 30-year pack smoking history and currently smoke or have quit within the past 15 years. Now, historically, lung screening has been studied and comparing it to an X-ray. So the National Lung Screening Trial looked at CT, which is a low dose CT, versus a chest X-ray. And what they found that there was a 20% reduction in lung cancer mortality in that study, and more cancers were diagnosed on a low dose CT versus a chest X-ray. And the National Cancer Institute actually stopped the trial so participants could be notified of the significant results. So we know that screening with low dose CT can reduce the risk of death from lung cancer for people at high risk for getting lung cancer. Now, it's very important to deliver the lowest radiation dose possible while still getting accurate exams. And these are strict guidelines that are followed by places that do offer lung screening. And despite the use of a low dose technique, it is important to be cognizant of radiation exposure, especially in cancer survivors who are undergoing screening, because they probably will have accrued a large cumulative radiation dose from both diagnostic and therapeutic sources over the course of their past treatments. Now, there are some harms that could be associated with low dose screening. For example, false positive results, which could result in other studies that are not necessary and lead to invasive procedures. Also finding incidental findings that could also lead to other workups that may not be necessary, that would not have affected the patients anyway, or overdiagnosis, meaning, but that's low, which refers to a cancer that might not have affected the patient due to other competing risk factors that could that the patient could have. So radiation harms, including cancer resulting from cumulative exposure to radiation, does depend on the age at the start of screening and the number of scans received. So if you want to know the dose, for example, what would be an effective dose, it's measured in millisieverts. In a general year, we are exposed just living in the world to about 2.4 millisieverts per year. Now, if you compare that to a chest X-ray, it's usually 0.06 to 0.25 of a millisievert. So that's a small dose. A low dose CT is somewhere around 1.4 millisieverts with a standard deviation of about 0.5. So it could be anywhere from about 0.9 to 1.9 millisieverts. A regular CT delivers about 7 millisieverts. So there is a big difference in radiation dose between a conventional CT scan and a low dose scan.